Well, all right. I guess a lot of people fell asleep. I noticed there were some people in Connecticut and Colorado and Georgia. So I'm just going to get started. Other people might join in as we're talking. So I'm recording this, so we're going to pause for any questions, and we'll not record any of the Q&A. So want to say hi well, Susan knows me. For those of you who don't know me, my name is Dr. Jason Nardi. I'm a chiropractor in Juneau, Alaska. I work at Valley Chiropractic Clinic. I am board certified in the diagnosis of internal disorders and diseases through the American Board of Chiropractic Internists. And as an internist who can't prescribe, I'm also board certified in clinical nutrition through the American Clinical Board of Nutrition. And I hold a fellow in medical acupuncture, which is one of the things I use cold laser for. So I want to say thanks for joining us. One of the things that we really strive for is to get people out of pain. Living with pain is not a very easy thing to do, and we are really happy to find non-invasive, holistic solutions to people's pain. So I'm going to start off by just going through some commonly asked questions about cold laser therapy. All right. So, what is cold laser therapy? So, it's a form of alternative medicine that stimulates healing using low levels of light. A couple terms that we use a lot for this type of therapy is low level light therapy, also low powered laser therapy, soft laser biostimulation, and the one I like to use, the one I think is most applicable, is something called photobiomodulation therapy. This basically just means using light to stimulate live tissue. The technique's called cold because, unlike other forms of laser therapy, low levels of light that we're using aren't really strong enough to heat up any of the body's tissue. Uh, there's other lasers that are known as hot lasers. Those are used for surgical procedures. They cut and can destroy healthy tissue. They're also used in certain types of cancer treatments as well. So during the use of cold laser therapy, basically a light's applied to the surface of the skin. We use three different lights in our laser. We have a laser in our office. So we use red laser, and which is not visible, and we use infrared, which is also not visible. But then we also use a visible red light. Basically what happens is the tissue absorbs that light through something called a photochemical effect. It's kind of the same effect that occurs when photosynthesis happens in plants. Light's not just a beam, it's not just a wavelength, it also has particles to it. But we're not going to get into that. That's, Einstein stuff, and that's way beyond the discussion we're going to have here. But the absorption of light increases cell regeneration to really help restore the function of those cells and helps aid in natural healing too. So, yeah, it's very safe. Cold laser is cleared by the FDA. There's several FDA-approved lasers on the market. We have the multi-radiance laser. It was one of the first ones to get an FDA clearance. But in comparison to some of the traditional treatments for pain, like medication, which can be habit-forming, or things like surgeries, cold laser is much, much safer. The research continues to support how effective cold lasers are. Different professional organizations are getting behind laser, like the WHO, the World Health Organization. The International Association for the Study of Pain is a big advocate of laser treatment now. And the American Physical Therapist Association, they're very big on laser. They're big fans of it. We used to use the whole thing of rest, where we would, raise, ice, compress, and elevate, right? Rest, ice, compress, and elevate. The PTs actually came up with something called MELT, which was mobilize, elevate, laser, and tape, and I kind of like that. One of the benefits of non-laser is, it's like I said, non-invasive, right? It's a non-invasive form of healing that's really painless. The sensation that is usually felt is a sense of kind of a calm or comforting, warming sensation. Some people feel a tingle. I actually just had a laser treatment done on my leg, and while the lasers were around my Achilles, my whole leg kind of felt warm and kind of fuzzy. It was a really good, relaxing feeling. The other thing that's great about laser is there's no recovery time needed after a session. You don't have to go home and ice. You don't have to, have these other procedures to make it work. You might have to, because of the timing of the illness, there might be some other things you have to do, like ice. But, in and of itself, those things aren't really required. Um, all right, I'm going to take a second because, there's not a whole bunch of folks on here, but I'm going to unmute everybody. I'm going to unmute Susan.
Hello.
Hi, any questions?
I'm wondering, I'm learning, I like holistic.
All right, cool. So let's see if we can get this working again. Hey, there we go. So there's a lot of uses for cold laser. Dentists, doctors, PTs, chiropractors, other medical professions, you're really being drawn into the cold laser. It's a non-invasive way to repair tissue, right? It provides relief from pain and inflammation and helps things heal faster. One of the things that we really like to use it for, we use it for both chronic and acute conditions, but we also use it for some post-operative pain. So an acute condition is one that's severe with a sudden onset, something that happened pretty recently, where a chronic condition is something that's long developing, it's been around for a while. So with a acute condition, cold laser is really effective when it's done right away, immediately after an injury to help reduce that inflammation and speed up the healing process. Where chronic conditions kind of, that's a little bit more useful in reducing the recurring inflammation and really helping with managing the pain. We use this a lot for post-op too. People who have had like a joint replaced, will have them come in for a week, a couple times in that week, and laser over the surgical area to help make it more mobile, help reduce some of the scarring as well. The use of cold laser therapy, again, is really useful for minor injuries and sprains. So we do it a lot for like ligament sprains, muscle strains, tendonitis, bursitis is another great one, tennis elbow, neck pain, lower back pain, knee pain. The laser we have, how they got their FDA approval was through a study called the Pillars paper, where they took a bunch of patients who were scheduled to have knee surgery and did some laser pretty often. They did it multiple times a week for a couple weeks, and most of those patients didn't require didn't require surgery because their pain had pretty much gone away. The other thing too that's pretty helpful with are things like muscle spasms. Again, back to wound healing, like I said, it really helps with post-surgical, but also with things like diabetic wounds. So those are pretty hard to heal. We see some things, especially in the feet and toes with diabetics, that take a really long time to heal. Laser is really great in making that work. One of the things that made me interested in laser was when I found out that NASA keeps lasers on the space station. And if an astronaut even so much as gets a scrape, the lack of gravity makes healing really difficult in space. So they go and laser their wounds, their bumps, scratches, and bruises on the space station to help heal like they would on Earth. So, it's really great in improving recovery time from things like surgery. It really reduces the pain and, again, the scarring as well. We like to do this in combination with some nutrition, like proteolytic enzyme therapy is really effective in helping get you back to the PT with more mobility. With acute pain conditions, one of the ones is something like carpal tunnel syndrome. So carpal tunnel syndrome is when there's compression of the median nerve, which passes through the wrist into the hand. There's two things that can cause it. One's a bony misalignment, right? You move a bone in your hand, it presses on the nerve. The other one is swelling, some inflammation that happens inside the wrist. And this inflammation also leads to compression. And the results are things like numbness, weakness, and tingling, especially in the last three fingers. So if I can't get that bone back into place and see, the resolution of those symptoms in a couple minutes after the adjustment, I reached for my laser. The laser works really well. We can see some immediate effects too within a couple minutes with carpal tunnel syndrome. There's a lot of chronic conditions though that are associated with the acute pain in carpal tunnel, and those are things like diabetes, thyroid dysfunction, fluid retention too from pregnancy and menopause is pretty common to see that associated with carpal tunnel syndrome, as well as high blood pressure and some of the autoimmune phenomenon like rheumatoid or something called Raynaud's. With chronic pain conditions, the fibromyalgia is a really great example, and it's one that I'm going to actually talk about a case that I've treated within the last year. And this is a chronic pain condition that's really characterized by muscle and skeletal pain. There's usually areas or points of tenderness throughout the body in multiple places. People with fibromyalgia generally have some tiredness. They're sleep disturbed. There's some cognitive dysfunction. They have a hard time remembering things. They have mood disorders. They're usually depressive. I had a lady come in for chiropractic care. She had pain all over her body. It had been going on for years, and she, was told by her family as well as her general practitioner that there was nothing wrong with her, and the pain was all in her head. She didn't respond to moderate chiropractic care. Like, she felt good when she left, but she'd come back and then everything would be pretty much the same. So one day I said, you know what? I think you have fibromyalgia, and we found 24 tender points throughout her body, mostly around her neck, shoulders, her back and ribs, the front of her chest, and some in her thighs. There were some tender points on the lateral part of her thighs. We did 30 seconds of laser on each one of those points. So what's that? About 12-minute session. At the end of that, we had 17 tender points left, and the pain went from an 8 to a 5. When she came back, she still had the same number of points. The pain was a little bit worse, she said, than when she left. So, but not as bad as when she came in the last time. When she left that day, she had a 3 pain. And what ended up happening after that, make a long story short, we saw her about 4 times. At the end of the 4th session, she was in tears. She was so happy that she had 0 pain, no more tender points. And she broke down in tears in our waiting room, gave me a big hug, which was, felt pretty good. A little embarrassing, but felt pretty good. So now my mouse is going to be, there we go. So the other one too that's really helpful are for spinal and joint pain. These joints can become inflamed, and this is usually due to things like injuries, flare-ups from chronic conditions like arthritis. Osteoarthritis, for example, is the most common cause of arthritis. This condition develops when the flexible tissue called cartilage around the joint starts to break down. Cartilage basically works as a means for the joints, the bones in the joints, to slide over each other, but also acts as a shock absorber. So when osteoarthritis occurs, it causes pain, stiffness, swelling, and can be pretty effective in reducing quality of life. Right? It's really hard to do a lot of things with it. The other thing that we see a lot of is herniated discs, and these can cause a lot of pain, especially when they disrupt the nerves around the spinal cord. Right? You can kind of see in this picture that little red bulge right there. That little yellow thing next to it, that's a spinal nerve. The symptoms are usually weakness, numbness, and electrical-like sensations or shocking pain or burning pain, pins and needles down the limbs. And you can have a herniated disc in your neck. You can have a herniated disc in your low back. Those are the 2 most common places to see them. Cold laser is a really great alternative to prescription medications or injections that just manage the pain from the herniated disc. With cold laser, not only are we reducing the pain, but we can reduce some of the swelling around it. That reduction of swelling makes the joint a little bit more mobile, and discs really need to have movement in them to be healthy. It actually creates a vacuum to suck some of that material that's bulging out back to the center. The next application isn't one that we do a lot of in our office, but it's a very widely used field for cold laser, and that's for skin rejuvenation. It's used for a lot of different problems, from acne and acne scars to psoriasis, burns, vitiligo, edema, or swelling in the skin. Even dermatitis and rashes respond really well. I've used this a lot for bruising. I use laser for folks who have bruises from injuries. It's pretty neat. You can see the bruise go away in about 24 hours in some cases. It's a pretty wild thing. Um, there's a lot of applications for cold laser. Research is ongoing. The list of its uses continues to grow. We're going to talk about a little bit of the research and what's going on out there in the field. One's a study that was in osteoarthritis. The Journal of Rheumatology compared outcomes of laser when used to treat osteoarthritis and rheumatoid arthritis. We had really great results with the rheumatoid arthritis, reducing something like 30% of morning stiffness for up to an hour after waking. But patients with rheumatoid arthritis who were treated with laser therapy, they had a 70% reduction in pain compared to the placebo group. Another one, again related to joint pain, was a study in the Journal of Manipulative and Physiological Therapies. This is from the American Chiropractic Association. And what they did is they compared spinal manipulative therapy, or the chiropractic adjustment, with low-level laser therapy in patients with something called Facet syndrome in their necks. This is a type of arthritis that reduces the range of motion, causes a lot of pain, as well as some numbness and tingling down the arms. What was great was the laser showed some results all by itself. The adjustments from the chiropractors showed results by themselves. What was really interesting is when they were combined together, the results were more than the accumulation of the results by themselves. So if we had 30% reduction in pain with laser and 40% reduction in pain with an adjustment, when combined, we weren't seeing 70%. We were seeing more of 90% reduction in pain. But the other thing that was really interesting about this study was not only was there a reduction in pain, but there was an increase in function, cervical ranges of motion, like rotating the patients rotating their heads or moving their ears closer to their shoulders, looking up and looking down. All of those improved as well. And the results of something called the Neck Disability Index scores dropped over the use of better when used chiropractic with laser in combination. So that's a pretty great study, and a big feather in the hat for cold laser. So some of the ongoing research for the future uses of cold laser therapy looks pretty promising. Some of the conditions being explored include things like concussion and traumatic brain injury. We've done this a few times, this off-label use of laser, where we've actually used a borosilicate glass probe that concentrates the laser beam, and have gone in to help stimulate nerves that are part of the cranial nerve system. And we do this by going in through the nasal canal as well as the ear. Pretty good results. We see a reduction in headaches from post-concussive headaches. We see a reduction in things like trouble with focusing the eyes or moving the eyes, and ringing in the ears. Some other things that we've seen are spinal cord injuries in the research. And very recently, they used laser and magnetic waves, which they called sound waves, in treating mice with Alzheimer's and Parkinson's plaques. It was a really great study because the light therapy was shown to reduce some of the plaques in the brains of these mice. So, quick review of the benefits, right? We looked at a bunch of things. So, to sum it up, cold laser therapy really helps reduce pain and inflammation without side effects. That's probably the number one benefit of cold laser. The applications are useful for acute and chronic conditions as well as post-surgical. The techniques are non-invasive, and sessions are usually customized and tailored to fit the individual. And sessions are quick and painless. Usually a session is about 15 minutes long, tops. Actually, that's not true. I've used laser about 24 minutes, 25 minutes. That's usually for multiple areas at the same time and the same treatment. But they're pretty quick. The protocols are pretty easy. There's very, very little pain. Um, let's see if we, oops, whoops, wrong button. Mm, Oops. Any questions?
No, just comments. I am interested to learn about how it helps different types of arthritis.
Yeah, it's kind of neat. When my folks used to come and visit us in North Carolina on their drives back and forth from Florida, my dad had some pretty he had shoulder pain, and he has uh, arthritis in his fingers and his left knee. And we would bring the laser home back to the house, and we'd laser him up for the weekend, and he'd drive another 10 hours in the car with no ill effect. And I remember him asking, he's like, hey, how do you pick one of these up? I'm like, Dad, they're not cheap. You don't just buy these, keep them around the house.
Yeah.
But it's kind of neat. It reduces some chemicals too in the blood that are called, one of the chemicals is called substance P, and substance P is found in tissue, and it's called that because it's the substance that causes pain. Physiologists aren't really creative, so when they found out the chemical that creates pain, they just called it substance P for pain. But we see that reduce, and we also see when we break down tissue in different types of arthritis, what ends up happening is the insides of that tissue, right? The insides of those cells are now outside of those cells, and those things are inflammatory. They cause your immune system to come in and do things to clean that stuff up, and that's where some of the degeneration happens in osteoarthritis. Rheumatoid arthritis is autoimmune, and that responds pretty well in helping to bring more blood to the area. One of the things our laser does is with the visible red light. We have 3 different types of light on there. We use the invisible laser and the invisible infrared, but we use visible red light, and that helps increase circulation to the area. It increases a chemical called nitric oxide, and nitric oxide reduces inflammation further in the blood vessels, but also increases the amount of new blood vessels to the area. So we create more circulation to the tissue.
Wow.
Yeah, it's pretty neat. So it works. That's how it works really well with diabetic neuropathy. Folks who have diabetes and start to lose normal sensation in their legs and feet. We use photobiomodulation. So the difference is I'm not necessarily treating the area that hurts all the time. I might just treat a very large artery that goes to the area to increase the amount of nitric oxide to the tissue. Um,
Oh, yeah.
yeah, we've been able to get sensation back in diabetics' feet. We measure sensation by sharp, soft touch, and vibration. I've seen sharp and soft touch come back regularly. Vibration's a little tricky. Some people get vibration back, some people don't.
Wow.
Yeah.
Does that take a lot of visits for um
Yeah. The joke I like to make, the thing that about laser is frequency, and I don't just
Yeah,
mean the frequency of the light. I mean the frequency of visits. Um,
right.
for a diabetic neuropathy, uh, 3 times a week for a couple weeks is usually all it takes, though.
Oh,
Yeah,
that's good.
yeah, it's not months or years worth of therapy.
I like anything where you don't have to use medicine to treat things, especially pain.
Yeah, it's so risky now. There's so many problems with pain meds that people get addicted to them, or
Right,
people become desensitized to them.
right,
For the pain meds, the side effect of things like gabapentin long term, the side effect for gabapentin long term is pain.
right.
So the medicines eventually can cause some issues, immediately or later down the road. Hi, Candace. um, we're kind of going to finish up real quick here. I'm going to go into some of the resources that I used, and we'll see if there's any questions at the end with Candace joining. I'm going to put you back on mute. Great. So I'll send a link out to you all too with some of the studies and some of the stuff that I used to put this together. I used a really great article from the National Institutes of Health PubMed called "Lasers and Their Therapeutic Application in Chiropractic." But we pulled some stuff from like Medical News Today. One which was really great came from a company called Light Cure. They're a company that just basically talks about research in lasers for practitioners. So listen, I want to thank you for taking time tonight. It's a beautiful night here in Juneau, and it's hard to get people online and not doing stuff. So, like I said, give us a call if you want to know if laser's right or if there's some other path to healing that's going to fit you better. I'm gonna tell you. Be more than happy to do that. I'm always available to talk to patients either on the phone, in person. We could do video now because of the epidemic going on. I'm going to say our phone number real quick. If you don't have it, it's 907-789-9549. And you can find out more about laser too on my website, which is nardichiropractic.com. That's NARDI chiropractic.com. I have a pretty decent little section about our particular laser and the things that we're using it for. And I'm going to record, this has been recorded, so I'm going to send you guys a copy of this if you want to send it to anybody. I'm going to post it up again on our social media as well with some of the links to the research underneath it. And I'm going to send you guys also a book about the immune system in chiropractic, just to kind of have as a reference. It's a lot of the research in immunity, especially when it comes to viruses, and how things like manual therapy and spinal manipulation can help protect your immune system and make it a lot stronger. Doing a talk on creating a healthier self next Tuesday night, another webinar. So check that out too. If you guys want to register for that, that'd be great. It's going to be a good combination of healthy eating, healthy habits, and holistic non-drug approaches to keeping yourself healthy. So thank you again, and keep an eye out for an email from me. And thanks so much for joining us. I appreciate you guys so much. Stay healthy.